Hello and welcome to this information video on spine surgery. If you are seeing this video, you are being offered a surgery on your spine. After this video is done, your surgeon will see you to go over what was covered in the video and help address any specific questions that you may have. After your visit today, you will complete a questionnaire to determine how well you understood everything, so we can ensure that you know what to expect and that we are helping you make the best choice for your health. So first, what have you been diagnosed with? A herniated disc is a protrusion or displacement of one of the discs in your spine. To give you some background, let's watch a video that will walk you through what a lumbar herniated disc is.
A spinal disc consists of two main parts, the jelly-like nucleus pulposus in the disc center, and the outermost layers, collectively called the annulus fibrosus. These two components facilitate the spine's movement and provide support for the vertebrae. Disc degeneration or trauma can cause the nucleus to herniate through the weakened layers of the outer disc and leak out of the annulus fibrosus into the spinal canal. In the case of a lumbar herniated disc, the weak spot in the annulus fibrosus is directly underneath the spinal nerve root, so a herniation in this area can put direct pressure on the nerve. The nerve root extends down the leg, and any type of pinching or pressure on the nerve in the lower spine can cause pain, numbness, tingling, or weakness to radiate along the path of the nerve down the leg. However, many people have shown a herniated disc on MRI scans, yet have no associated pain, so not all herniated discs will cause symptoms.
What are your treatment options? The first line of treatments include oral painkillers, physical therapy, cortisone injections, which can be epidural or transforaminal. What about surgery? While the first line treatments can help manage your symptoms, if you choose not to go through with a surgery for spinal stenosis, there can be a progression and worsening of your symptoms. What if you do have a surgery? To give you some background, let's watch a video that will walk you through a lumbar discectomy.
Lumbar microdiscectomy surgery is performed to remove the portion of a herniated disc that is irritating or inflaming the nerve root. A microdiscectomy is performed through a small incision in the midline of the low back. First, the back muscles, called erector spinae, are lifted off the bony arch, called the lamina, of the spine. Since these back muscles run vertically, they can be moved out of the way rather than cut. The surgeon is then able to enter the spine by removing a membrane over the nerve roots. This membrane is called the ligamentum flavum. Often, a small portion of the inside facet joint is removed both to facilitate access to the nerve root and to relieve pressure over the nerve. The nerve root is then gently moved to the side, and the disc material is removed from under the nerve root. Only the herniated portion of the disc is removed. The healthy portion of the disc is left intact. After the piece of the disc that is irritating or inflaming the nerve root has been removed, the pressure is off the nerve immediately and it has room to heal. A herniated disc pressing on a nerve root can cause severe leg pain. While it may take weeks or months for the nerve root to fully heal and any numbness or weakness to get better, patients normally feel relief from the leg pain almost immediately after a microdiscectomy.
So what are the goals of surgery? We want to prevent your symptoms from getting worse. We want to possibly alleviate existing symptoms, but this will likely not eliminate all symptoms. What we aim to do is to get you back to basic day-to-day functions. Leg pain is typically more improved than back pain. By the 3-month mark, there is typically a noticeable improvement in your symptoms. With normal wear and tear of the body, your symptoms may eventually return over the course of several years. It's important to note that these symptoms could occur at different spinal levels as well. Disease recurrence is the most common cause of failed surgery. So what are the risks that you should be aware of? Nerve damage. It is possible to suffer nerve injuries during the surgery, but this is rare. A spinal cord injury is extremely unlikely as the spinal cord terminates at the T12 vertebral level of your body and the surgeries occur below this level. Bowel and bladder incontinence is very unlikely to occur, about 1 in 10,000 patients. A dural tear refers to a tear in the material surrounding the sac that contains the spinal cord. This can occur in patients, but we manage this through repair at the time of surgery, and if it does escape our notice, most can be managed without any further surgery. Bleeding that requires transfusion can occur, but it is unlikely as this surgery is not intended to be extensive. Infection can occur in 1% of patients. However, there are varying degrees of infection. Most infections are superficial and can be treated with antibiotics. Deeper infections can require hospitalization and a revision surgery. What should you expect moving forward? Today it will be decided by you and your surgeon whether or not you will proceed with surgery. If your surgeon deems it appropriate, you will be seen within the upcoming weeks prior to your surgery at the pre-anesthesia clinic to see if you are medically fit for surgery. The information you need about the pre-anesthesia clinic will be provided to you today if you book your surgery. For the night before the surgery, the pre-anesthesia clinic will discuss rules to follow that are specific to you, such as which medications to take and when is the last meal that you can have. The day of the surgery, the pre-anesthesia clinic will go over specifics, but you will be registered in the hospital and taken to the waiting room. We recommend that you bring a companion with you. The surgery will be performed based on what the surgeon has discussed with you, and you will be under general anesthesia, or asleep. Immediately after the surgery, you will wake up in the OR and be taken to the post-operative care unit until the deep effects of the anesthesia wear off. Two possible things can happen at this point. If you're feeling well, you can actually go home, or you will be admitted to the ward for a short stay for a night or two. If you've had a urinary catheter placed, it will be removed prior to you being discharged, and we will make sure you're urinating adequately before being discharged. So what can you expect after the surgery? Pain. You'll likely experience some pain, which will be best managed using a conservative amount of painkillers ranging from Tylenol up to opioid-type medications if necessary. However, this surgery is not particularly invasive, and we highly recommend minimizing the use of these strong painkillers as you can become dependent. For the next several weeks, you may have muscle pain or spasms. You may have long-term tingling or numbness that may not resolve. This has to do with the incision being made in the skin and the superficial nerve trying to grow back. It typically lasts 3 months. Your dressing must remain on for the next 5 days. You can shower, but avoid getting the dressing wet. Do not submerge in any standing water like a bath or a hot tub. At 2 weeks after the surgery, your family doctor will check you to see if you're healing well and remove any sutures or skin clips as needed. We recommend that you have someone at home for the next 3 to 4 days following your surgery to help with daily tasks. Return to work. For non-labor intensive jobs, you may return to work within a week, but attempting to minimize flexing and extending the spine. It's better to bend at the hips and knees and keep your back straight. For labor-intensive jobs, we recommend a minimum of 6 weeks off and a gradual return to work. We do not believe that you will need any physiotherapy after the surgery. To make sure you understand all of this information that was given to you, we are going to give you a brief questionnaire. You can ask your surgeon about any specific questions you may have. Thank you for watching.